Ready? Let's do this. There are 48 multiple choice questions in this video. Ready? The lobes of the thyroid gland are connected by A. The isthmus. B. Parathyroid tissue. C. Isthmal tissue. D. Island tissue. The answer is A. The isthmus. Hyperfunction of all parathyroid glands with no apparent cause occurs with which one of the following? A. Primary hyperplasia of the parathyroid glands. B. Primary hyperparathyroidism. C. Secondary hyperplasia of the parathyroid glands. D. Secondary hyperplasia of the thyroid gland. The answer is A. Primary hyperplasia of the parathyroid glands. All of the following structures form neighboring structures for the thyroid gland except the A. Longus colli muscle. B. Sternocleidomastoid muscle. C. Parotid muscle. D. Strap muscles. The answer is C. Parotid muscle. A higher percentage of positive cells are observed in what of a thyroid mass? A. Small calcifications. B. Anechoic portion. C. Center. D. Complex portion. The answer is A. Small calcifications. What is a palpable anterior midline mass between the hyoid bone and the isthmus of the thyroid gland? A. Carotid aneurysm. B. Brachial cleft cyst. C. Parathyroid adenoma. D. Thyroglossal duct cyst. The answer is D. Thyroglossal duct cyst. Common disorders associated with hyperthyroidism include all of the following except A. Toxic adenoma. B. Toxic multinodular goiter. C. Graves' disease. D. Acute thyroiditis. The answer is D. Acute thyroiditis. A cystic formation lateral to the thyroid gland is typically which one of the following? A. Thyroglossal cyst. B. Brachial cleft cyst. C. Cystic hygroma. D. Sublingual cyst. The answer is B. Brachial cleft cyst. A solitary thyroid nodule in the presence of ipsilateral lymphadenopathy suggests which one of the following? A. Adenoma. B. Graves' disease. C. Malignancy. D. Hashimoto's thyroiditis. The answer is C. Malignancy. D. Hashimoto's thyroiditis. All of the following structures form neighboring structures for the thyroid gland except the A. Longus colli muscle. B. Parotid muscle. C. Strap muscles. D. Sternocleidomastoid muscle. The answer is B. Parotid muscle. An abnormal lymph node demonstrates which one of the following? A. Homogeneous texture. B. Central echogenic complex. C. Oval contour. D. Round contour. The answer is D. Round contour. Approximately 20% of solitary thyroid nodules are A. Cystic. B. Adenomas. C. Goiters. D. Malignant. The answer is A. Cystic. Common disorders associated with hyperthyroidism include all of the following except A. Toxic adenoma. B. Toxic multinodular goiter. C. Graves' disease. D. Acute thyroiditis. The answer is D. Acute thyroiditis. Increased vascularity with color Doppler, termed the thyroid inferno, is observed in A. Hashimoto's disease. B. Graves' disease. C. De Quervain thyroiditis. D. Papillary carcinoma. The answer is B. Graves' disease. Sonographically, the normal thyroid gland may be described as having all of the following characteristics except A. Diffusely homogeneous. B. Slightly more echogenic than surrounding muscle. C. Fine homogeneous echo texture. D. Having a thin, hyperechoic line representing the thyroid capsule. The answer is A. diffusely homogeneous. The approximate dimensions of the thyroid gland are a 5 cm length, 2 cm width, 2 cm depth. B 4 cm length, 5 cm width, 2 cm depth. Circa 3 cm length, 5 cm width, 2 cm depth. D 6 cm length, 3 cm width, 3 cm depth. The answer is 5 cm length, 2 cm width, 2 cm depth. The most common cause of primary hyperparathyroidism is which one of the following? A. Thyroid adenoma. B. Parathyroid adenoma. C. Parathyroid cyst. D. Parathyroid hemorrhagic cyst. The answer is B. Parathyroid adenoma. The most common cause of thyroid disorders worldwide is which one of the following? A. Hypothyroidism. B. Iron deficiency. C. Iodine deficiency. D. Autoimmune process. The answer is C. Iodine deficiency. The most common cause of thyroid malignancy is what type of carcinoma? A. Papillary. B. Medullary. C. Anaplastic. D. Follicular. The answer is A. Papillary. The normal parathyroid glands measure less than how many millimeters? 3, 4, 5, or 6. The answer is B. 4 millimeters. The parathyroid glands are the what organs in the body? A. Calcium sensing. B. Potassium sensing. C. Vitamin K sensing. D. Vitamin C sensing. The answer is A. Calcium sensing. The thyroid gland is part of the what system? A. Skeletal.lb. Gastrointestinal. C. Endocrine. D. Reproductive. E. Vascular. The answer is C. Endocrine. Sonographically, the normal thyroid may be described as having all of the following characteristics except A. Inhomogeneous echogenic pattern. B. Sternocleidomastoid, longus colli, and strap. Muscles are hypoechoic compared with thyroid tissue. C. Homogeneous texture of medium echogenicity. D. Tubular, anechoic vessels. The answer is A. Inhomogeneous echogenic pattern. All of the following improves scanning visualization of the parathyroid/thyroid gland except A. Using longus colli muscle as a landmark. B. Having the patient hyperextend the neck. C. Flexion of head and shoulders. D. The use of a high-resolution transducer. The answer is C. Flexion of head and shoulders. Landmarks for the transverse image of the thyroid include all of the following except A. Trachea. B. Common carotid artery. C. Axillary vein. D. Jugular vein. The answer is C. Axillary vein. A longitudinal image of the thyroid and the lateral aspect should include the following structure: A. Parathyroid gland. B. Carotid artery. C. Larynx. D. Isthmus. The answer is B. Carotid artery. What are the neck muscles that are seen as a larger oval band? They lie anterior and lateral to the thyroid gland. A. Longus colli muscles. B. Esophageal muscles. C. Sternocleidomastoid muscles. D. Omohyoid muscles. The answer is C. Sternocleidomastoid muscles. A normal functioning thyroid with adequate amounts of thyroid hormone is called what? A. Thyroid agenesis. B. Hyperthyroid. C. Hypothyroid. D. Euthyroid. The answer is D. Euthyroid. If the thyroid is scanned in a transverse plane, the labeling annotations should include all of the following except A. Mid. B. Superior. C. Lateral. D. Inferior. The answer is C. Lateral. If a sonographer is scanning in a longitudinal plane and presently imaging the external jugular, in which direction should the transducer be moved to see the main thyroid gland? A. Medial. B. Lateral. C. Superior. D. Inferior. The answer is A. Medial. The mechanism for producing thyroid hormones is what metabolism? A. Sodium. B. Calcium. C. Zinc. D. Iodine. The answer is D. Iodine. Blood is supplied to the thyroid gland by how many vessels? A. 2 arteries and 2 veins. B. 3 arteries and 1 vein circa 4 arteries. D. 4 veins. The answer is C. 4 arteries. If a sonographer is scanning the inferior lobe of the thyroid in a transverse plane, in which direction does the transducer need to be moved to image the isthmus? A. Inferiorly. B. Superiorly. C. Axially. D. Laterally. The answer is B. Superiorly. The structure arises from the isthmus and tapers superiorly just anterior to the thyroid cartilage. A. Carotid artery. B. Pyramidal lobe. C. Superior lobe. D. Parathyroid gland. The answer is B. Pyramidal lobe. In a sagittal scan of the thyroid's inferior lobe, the most inferior portion is located on the what side of the screen? A. Left. B. Right. C. Top. D. Bottom. The answer is B. Right. What hormone is a thyroid hormone that is important for maintaining a dense strong bone matrix and regulating the blood calcium level? A. Serum calcium. B. PTH. C. TSH. D. Calcitonin. The answer is D. Calcitonin. A solitary thyroid nodule in the presence of ipsilateral lymphadenopathy suggests which one of the following? A. Follicular carcinoma. B. Adenoma. C. Graves' disease. D. Hashimoto's thyroiditis. The answer is A. Follicular carcinoma. The most common cause of primary hyperparathyroidism is which one of the following? A. Thyroid adenoma. B. Parathyroid adenoma. C. Parathyroid hemorrhagic cyst. D. Parathyroid cyst. The answer is B. Parathyroid adenoma. The normal parathyroid glands are located on the where and where surface of the thyroid gland? A. Anterior, medial. B. Anterior, lateral. C. Posterior, medial. D. Posterior, lateral. The answer is C. Posterior, medial. The parathyroid glands produce a hormone that affects the A. Kidneys, bones, and gastrointestinal tract. B. Gastrointestinal tract, breast, and scrotum. C. Liver, colon, and kidneys. D. Kidneys, heart, and colon. The answer is A. Kidneys, bones, and gastrointestinal tract. The pyramid lobe of the thyroid gland extends from the where? A. Inferior left lobe. B. Superior isthmus. C. Inferior right lobe. D. Superior right lobe. The answer is B. Superior isthmus. The thyroid gland consists of how many lobes? 2, 3, 4, or 6? The answer is A. 2 lobes. The thyroid is an endocrine gland that regulates metabolic function through the production of all of the following hormones except A. Thyroxine. B. Triiodothyronine. C. Thyrocalcitonin. D. Thyroliberin. The answer is D. Thyroliberin. Which one of the following structures lies medial to the left thyroid lobe? A. Larynx. B. Jugular vein. C. Strap muscles. D. Longus colli muscle. The answer is A. Larynx. The thyroid gland develops at the floor of which structure? A. Primitive pharynx. B. Trachea precursor. C. Maxilla. D. Nasopharynx. The answer is A. Primitive pharynx. Which one of the following sonographic features of a thyroid adenoma is the most common? A. Complex echo pattern. B. Hyperechoic mass. C. Hypoechoic peripheral halo. D. Irregular margins. The answer is C. Hypoechoic peripheral halo. Usually, how many parathyroid glands exist? A. 2. B. 3. C. 4. D. 5. The answer is C. 4. When the serum calcium level what? The parathyroid glands are stimulated to release PTH. Increase, decrease, or the same? The answer is decrease. Which one of the following structures lies posterolateral to the thyroid gland? A. Longus colli muscle. B. Hyoid muscle. C. Larynx. D. Internal carotid. The answer is A. Longus colli muscle. Thank you for watching. I hope this video helps with your exams. Good luck! Don't forget to share, like, comment, and subscribe.